Mental health is not just personal, it's political. Hi, I am Rashidat Balogun, also known as RB, and welcome to this 20-part series where we're going to be exploring how politics directly and indirectly affects our mental health. Yes, politics. Before you click away thinking, this series is not for you, let me tell you something. Your mind is affected by more than your emotions. It's affected by your environment, your leaders, your country's choices. So yes, mental health is political, and that's what this series is all about. From budget allocations to policies to infrastructures, everything connects and they shape how we think, feel and live. And unless we begin to talk about it, we'll keep thinking mental health is just an individual issue when really it's a structural one. So get ready to not just learn, but be part of the change, because what does it really mean to say mental health is political? When we say mental health is political, we're not just talking about politicians. We mean that our mental well-being is shaped by power, who has it, who doesn't, and how it's used. Think about it. Who decides how much of the national budget goes to mental health? Who decides if your local clinic gets a therapist? Who decides if a displaced child gets therapy after witnessing insurgency? Who sets the policies regarding our mental well-being? These are political decisions. The laws, systems and leadership decisions around us shape the stress we carry, the trauma we endure, and whether we get help or not. Mental health is political because the system can either protect your sanity or break it. Did you know that mental health care is your right? Just like clean water, education, and safety, you have a right to dignity, emotional support, and to care when you're in distress. In many African countries, people with mental health conditions are locked away, abused, or left untreated. Some are even seen as cursed, others are abandoned by their families. Most never get professional support. Why? Because mental health hasn't been prioritized as a right. Mental health is still treated as a privilege, something for rich people. The United Nations recognizes mental health as a fundamental human right. Yet, so many governments in Africa act like it's optional. If you are in pain and there is no affordable, accessible help, that's a violation of your rights. That's why we must keep demanding that mental health is protected, not as charity, but as a basic human right. When we treat mental health as a human right, we demand accountability from governments. We demand equity, and we demand that care is not based on status, gender, tribe, or age. So you see, mental health is political. Let's talk money, or rather, the lack of it. Did you know that in Nigeria, less than 4% of the health budget goes to mental health, while many other African governments allocate less than 5%? And in Nigeria, mental health is not covered under the National Health Insurance Scheme, NHIS. That means millions of people must pay out of pocket, and those who can't afford are often left to suffer. A woman battling postpartum depression might be covered for childbirth, but not for the emotional stress that follows. That is what happens when mental health is not seen as a budget priority. Budgeting is political. Where the money goes shows what matters. It tells us what a government values, and when mental health is underfunded, the message is loud and clear. Your mind does not matter. But we can change that by raising our voices, advocating for policies that prioritizes our mental health, and demanding that mental health is fully funded. Because a healthy mind needs more than just awareness. It needs investment, and it needs financing. To understand why mental health care looks the way it does in Africa today, we need to go back, way back to when the systems were never built for us. During colonial era, African health systems were built to serve the colonizers, not the local population. Mental health care, it was mostly punishment-based. Asylums, chains, forced treatments. And unfortunately, that mindset stayed with us for far too long. In Nigeria, we operated under the Lunacy Act of 1958, a law introduced during colonial times that referred to people with mental health conditions as lunatics and emphasized confinement over care. For decades, this outdated law shaped how the system treated people living with mental illness, not with compassion but with control. In January 2023, Nigeria finally repealed the Lunacy Act and passed the Mental Health Act, a more progressive law focused on rights, dignity, and community-based care. And even with the new act, implementation is still needed. Many African countries still operate with mental health laws written in colonial era. Colonialism did not just exploit our resources, distorted how we see mental health. To reform mental health care, we must decolonize it. That means writing and implementing new laws, investing in community-based care, and training culturally competent professionals. Let's talk about what happens when you are ready to seek help, but help doesn't exist. In many parts of Africa, mental health infrastructure is either outdated, too far away, not accessible, or doesn't exist at all. In Nigeria, a country of over 200 million people, there are only 8 federal neuropsychiatric hospitals with only a handful of trained professionals. 8 for the entire country. Most of them are located in major cities, leaving rural and underserved communities without access to specialized care. This is not just a medical problem, it's a political failure, a result of decades of underfunding, weak policies, and lack of political will. Mental health services should not be a privilege for the wealthy or those living in big cities. It should be a basic part of every community's healthcare systems. We need investment in people, places, and systems that provide mental health care, because until we fix the infrastructure, we cannot truly support the people. Mental health infrastructure is not a bonus, it's the foundation. Imagine fleeing your home because of war or terrorism. You've lost loved ones, seen violence, and now live in an overcrowded camp. That trauma doesn't disappear. In places like northern Nigeria, South Sudan, or the eastern Congo, thousands live with untreated psychological wounds caused by conflict. People are forced to flee their homes. Children witness violence. Women experience sexual abuse. Men live with survivor's guilt. Families are torn apart. Many are emotionally broken and suffer from anxiety, PTSD, depression, with no form of therapy provided to them. Humanitarian aid often provides food, water, and shelter, but rarely mental health support. No trauma counselors, no grief therapy, no systems to heal. Psychological recovery is not included in our emergency responses. This is a political failure. Mental health must be a core part of humanitarian and post-conflict rebuilding plans, because rebuilding after war isn't just physical, it's psychological, and if trauma is left untreated, it becomes a silent weapon passed on through generations. Democracy is meant to empower us, but in many African countries, elections come with fear and trauma. The anxiety before the results, the fear of rigging, the fear of violence, the fear of being silenced for speaking out, the stress when there's chaos at your polling booths. These elections sometimes come with political protest and civic unrest, which takes a toll on our mental health. But our government rarely provides mental health first aid or emotional support after such national stressors. We must advocate for systems where political participation includes protection for people's mental and emotional well-being, because no one should have to sacrifice their sanity to participate in a democracy. Your mental health is not just personal, it's political, and it's time we made it a priority. Let's talk about a group that is often invisible: neurodivergent people. Autism, bipolar disorder, ADHD, schizophrenia, these conditions are rarely talked about and even more rarely protected under the law. In many African countries, there is no national policies for neurodivergent inclusion. Public schools don't have special education programs, workplaces don't accommodate, health systems don't screen or support them. This isn't just stigma, it's political erasure. Mental health policies must include neurodivergent communities. That means inclusive education, disability rights, training for healthcare providers, and protection under the law. We cannot achieve social justice until neurodivergence is seen, heard, and supported at the policy level, because mental health is not just personal, it's political. It's hard to think about mental wellness when you're struggling to survive financially. A young graduate with no job for 5 years, a parent unable to feed their family, a market woman forced to close her shop after inflation triples her costs. A lot of people are struggling with their mental health because of economic hardship and poverty. Economic hardship hits more than your wallet. It drains your energy, your hope, and your mental well-being. Poverty and unemployment increase the risk of depression, anxiety, substance abuse, and even suicide. And when government fail to create jobs, support small businesses, or provide safety nets, they are not just failing the economy, they are harming the mental health of their people. We need policies that prioritize the people: affordable housing, job creation, access to healthcare, including mental health care, plus a stable economy. Because at the end of the day, economic survival and emotional survival go hand in hand. Behind prison walls in Africa, there are thousands of people battling untreated mental health conditions. Some ended up there because of their mental state, others developed depression, anxiety, or psychosis while imprisoned due to overcrowding, abuse, and dehumanizing conditions. Many even haven't been convicted, they've been awaiting trial for years. Most prisons lack trained mental health professionals. There is no therapy, no medications, just punishment. And for those living with psychosocial disabilities, prison becomes a death sentence, not because of their crime, but because they never got the care that they needed. We should advocate for integration of mental health services into our prison systems, train staffs on trauma-informed care, and offer alternatives to imprisonment for mentally ill offenders. If our prisons are rehabilitation and correctional centers, then mental health must be a pillar of our prison systems, not an afterthought. Mental health is political, and one of the biggest political decisions we must demand is that mental health should be integrated into primary health care. Why? Because primary health centers are the first stop for most people, but they are not trained or equipped to handle mental health. So people show up with depression and live with paracetamol. When mental health is integrated into everyday health care, people get help faster. Stigma reduces because it becomes normal to talk about emotions and stress, and fewer cases spiral into crisis. People are already showing up to the clinics. We just need the clinics to show up for their minds too. The World Health Organization recommends integration, and some African countries are beginning to implement it. But we need more. Because true health is not just about the body, it's about the mind too. And we can't claim to care about public health if we leave mental health out of the picture. Across Nigeria and Africa, healthcare workers face long hours, low pay, poor working conditions, and constant emotional stress. Imagine witnessing death daily, carrying the burden of other people's pain, all while dealing with underfunded systems, overcrowded hospitals, and lack of essential tools. Now add violence from patients' families, zero workplace mental health support, and sometimes stigmatization for seeking therapy. Many healthcare workers burn out in silence. Some quit, some break down, some take their own lives. And here's the hard truth. There is no real systems in place to protect their mental health. No national policy support to support their psychological well-being. No regular counseling programs. No check-ins. No safety nets. It's time we start asking, who cares for the caregivers? Mental health support must be part of healthcare policy, not just for patients, but for providers too, because you simply cannot pour from an empty cup. So you see, mental health is political. There is a mental health crisis in our schools. Academic pressure, bullying, sexual abuse, cultism, anxiety about the future, and yet very few schools have guidance counselors or mental health programs. In Nigeria, most public schools lack any form of psychosocial support. Teachers are not trained to recognize distress, students have no one to talk to, and when they do speak up, they are often dismissed or shamed. The result, rising cases of depression, substance use, and suicide. Mental health should be part of education policy. That means trained school counselors, peer support programs, and safe reporting systems. It also means embedding emotional intelligence literacy and mental health education into the school curriculum, just like civic education and physical health education. If we want to protect the future, we must start with the minds of young people. In Africa, traditional and religious institutions have huge influence over how people view mental health. They shape beliefs and influence decisions. So the question is, are these institutions allies or barriers? Well, the answer is both. These institutions are not the enemy, but they must be part of the solution. To make progress, we must engage traditional and religious leaders as partners in mental health education. Train them to recognize when spiritual support must give way to medical care, and encourage them to refer to professional care when needed. We can also incorporate faith and culturally based practices into mental health programs. The government should also regulate harmful and inhumane practices like chaining or beating that still happens in the name of healing. With understanding and mutual respect, faith and culture are powerful tools. When used with compassion and wisdom, they can become bridges, not barriers, to mental health care. Let's talk about something we don't often link to mental health: the environment. When the environment is destroyed, so is our peace of mind. Floods displace families, droughts destroy livelihoods, pollution poisons communities, natural disasters wipe out entire villages. Behind every climate event is a story of grief, loss, fear, and uncertainty. The impact of climate change is a mental health issue too. The fear of losing everything, the pressure to start over, and the hopelessness that follows are all psychological wounds. Yet, many African governments respond with silence or surface level interventions. Our response plans don't include mental health recovery. Environmental policies rarely mention emotional impacts. We need climate policies that include trauma support. We need disaster response teams with mental health experts and relocation plans that consider psychological distress. We also need climate change to be taken seriously because protecting the environment also means protecting people's minds. How can we solve a problem we can't measure? Across Africa, one of the biggest challenges in mental health care is the lack of reliable data. How many people live with depression? How many children have ADHD? Where are the gaps in services? What interventions actually work? We don't fully know because we don't fund research. Mental health is often missing from national health surveys. Universities lack resources to study it, and policymakers have no evidence to guide change. Without data, mental health remains invisible. We need funding for mental health research. We need data to drive decisions. We need to understand what's working and what's failing. Data is not just numbers, it's stories made visible, it's power, it's proof. Without research, we are just guessing, but with data, we can treat and build systems that actually work. What happens when the healers leave? When those trained to care for our minds walk away? Not because they want to, but because they have to. Nigeria has fewer than 300 psychiatrists for over 200 million people, but even that number is dropping fast because many professionals are leaving. They are moving abroad for better pay, safer working environments, and more opportunities. The result? Fewer doctors for millions of people, burnout for those who remain, long waits, poor care. Brain drain is a political failure. It's about wages, working conditions, and how government value mental health. It reflects how little our system values its workers, how poorly mental health is funded, and how caregivers are forced to choose between serving their country and preserving their sanity. The solution is that working conditions must improve. Wages should be better. There should be more opportunities to thrive, and the system should be fixed to care for workers. In January 2023, Nigeria made history. After over 6 decades, the colonial era Lunacy Act was finally repealed and replaced with the Mental Health Act. It was a moment of celebration, a long overdue recognition that outdated, dehumanizing laws have no place in modern Nigeria. But 2 years later, we must ask, did we make change or just make headlines? The Act promises access to mental health care, protection from abuse, community-based services, and the establishment of a mental health department within the Federal Ministry of Health. But laws are only as powerful as their implementation. Presently, there is a mental health department within the Federal Ministry of Health, but many still don't know that the mental health law exists. There is no widespread public awareness, no clear budget for enforcement, no visible transformation in mental health infrastructure, and the mental health fund it promised still not operational. We need political will to move from paper to action. We need state-level adoption, training of professionals, provision of infrastructure, accessible and pocket-friendly mental health care, subsidized medications, mental health insurance, enforcement mechanism, and public education. Because a law that sits in silence cannot protect anyone. So is the Mental Health Act a milestone? Yes, but it must be implemented and executed. We've spent this series exploring how politics directly and indirectly affects our mental health. We've seen the problems. Now, the question is, what do we do about it? To be honest, mental health won't become a national priority by accident. It takes pressure. It takes participation. As citizens, we must learn to ask the right questions. Is there a mental health plan in your state? Does your governor or representative talk about mental health? Is mental health in the budget, in the schools, in hospitals, in manifestos? And if the answer is no, we must demand better. We can ask questions during campaigns and town hall meetings, write letters to lawmakers and health ministries, use social media to spotlight stories and share facts. Join or support organizations pushing for policy change. Educate others, especially those in power, on why this matters. Mental health is our right, and if our leaders won't prioritize it on their own, we must make it politically costly to ignore. Democracy doesn't end at the ballot box. It lives in our voices, our demands, and our refusal to be silent. Mental health must be on every agenda: health, education, justice, economy, and environment. So speak up. Your voice is a tool. Change doesn't happen by chance, it happens when we demand it. Because mental health is not just personal, it is political.